Hello. Today we will be discussing the importance and functionality of glucose monitors. To get started, what are glucose monitors? Glucose monitors are devices that, through measuring bodily fluids, can provide insight into how much glucose is in a person's bloodstream at any moment in time. Why do we care about blood glucose levels? For patients with diabetes, it is extremely important to know blood glucose levels to help manage the disease and to reduce serious long-term complications. When we eat, our bodies convert food into energy. They do this by breaking food down into glucose, which is then released into the bloodstream for easy uptake by cells. In healthy patients, the presence of glucose in the bloodstream triggers the pancreas to produce insulin, which facilitates cellular uptake and glucose storage in the liver. However, diabetic and pre-diabetic patients experience dysfunction in this insulin pathway, either in that they do not produce insulin, or they have poor cellular absorption of glucose due to persistent high blood glucose, resulting in insulin resistance. Globally, diabetes afflicts nearly 537 million adults worldwide, and if left untreated or unmanaged, it can result in many serious complications such as heart disease, vision deterioration, and kidney failure, among other comorbidities that increase patient mortality.
Initially, glucose levels were only measured by physicians. These early test methods were optical colorimetric tests, where glucose could be detected in urine or blood samples. One of the notable early test strips was the DextroStix, which was developed in 1965 and was the precursor to the first glucometer in the 1970s. As we have made advancements, we have replaced physician-mediated tests with self-monitoring of blood glucose for daily management.
There are several ways to currently measure blood glucose, both directly and indirectly. Blood glucose levels in the body can be measured directly using blood or indirectly by measuring glucose in interstitial fluids, tears, saliva, and urine. The most widely adopted glucose detection method involves enzymatic amperometric glucose biosensing via an invasive finger prick test. The enzyme most frequently used for blood glucose monitoring is glucose oxidase, or GOX, as it is a relatively stable enzyme and demonstrates high selectivity and high sensitivity for glucose. The pathways for glucose detection involves glucose as the analyte binding with a glucose oxidase-coated bioreceptor. The resulting reaction produces gluconic acid and hydrogen peroxide. The hydrogen peroxide then oxidizes in the presence of an electrode and releases electrons, resulting in a measurable voltage change, which can be directly related to the concentration of glucose in the blood. The greater the glucose in the blood, the higher the voltage generated, which is then translated to an output in blood glucose concentration.
There are some notable shortcomings with the current finger prick glucometers. 1. They're uncomfortable, especially for patients who are testing their blood glucose levels 4 to 10 times a day. 2. Because you're sampling from the finger, there is a risk of contamination of the sample if the finger isn't prepped and cleaned properly. 3. While the glucose oxidase is a relatively stable enzyme, it can still be impacted by temperature and humidity.
Electrochemical detection of glucose using glucose oxidase is by far the most commonly adopted blood glucose measurement pathway. Beyond glucometers, it is found in all continuous glucose monitors, or CGMs, which translate interstitial fluid glucose to blood glucose. CGMs must still be calibrated using a blood test, but they operate with a microneedle inserted into the skin to continuously detect glucose levels. This provides patients with continuous data that, depending on the model, can automatically provide warnings when blood glucose is high or low and integrate with insulin pumps to react to those measurements.
Other detection methods in use include optical detection with colorimetric changes for glucose present in urine, sweat, saliva, and tears. These sensors work much like pH test strips in that when a sample interacts with a treated substrate, it results in a visible color change that can be compared to a calibration color wheel. Additionally, optical detection using fluoroscopy is used and works by glucose binding with a quenched or turned off fluorophore, resulting in electron transfer when excited by UV light, enabling detectable fluorescence that is more intense with more glucose. This type of detection is being explored to be expanded into biowearable sensors. So, after all of that, what comes next? Diabetes is and will continue to be a major health issue for millions of people, and there's lots of research being done to develop less invasive means of monitoring blood glucose. Hopefully now you have a foundational understanding of some of the common blood glucose detection methods. Thank you for viewing!